Hello, occupational therapy practitioners, and welcome to the Generalist resource to integrate driving, better known as GRID. The GRID is a resource for general practice occupational therapy practitioners to integrate driving into their practice. It is a tool designed to provide specific guidelines for generalists to evaluate, create, and implement intervention plans to develop or restore the client's valued IADL of driving and community mobility. Before we dive into the details of the GRID, let's meet the authors. The GRID was developed by 3 occupational therapists, all who specialize in driving: Dr. Terri Cassidy, Dr. Dickerson, and Susie Touchinsky. Dr. Terri Cassidy is an innovative and inspiring occupational therapist and certified driver rehabilitation specialist in Colorado. Her practice, Health Promotion Partners, focuses on promoting engagement and independence in the home and community. Dr. Dickerson is an occupational therapy professor at East Carolina University in North Carolina. She is the director of the Research for Older Driver Initiative, has received numerous awards, including ECU's 2018 Lifetime Achievement Award in Research, and has published widely supporting occupational therapy's role with driving and community mobility. And my name is Susie Touchinsky. I am an occupational therapist and driver rehabilitation specialist with over 20 years of experience. I currently own Adaptive Mobility Services in Pennsylvania and offer both client driver rehabilitation services and education for OTs on driving. Together, the 3 of us are self-proclaimed driving geeks. We love to work with all occupational therapy practitioners, from the general practice OT to the specialist, and to collaborate and provide education. The Generalist resource to integrate driving, or GRID, was developed to support this goal. Our goal is to give you an introduction and to encourage OTs to use the GRID. Specifically, we will discuss why the GRID is important, who the GRID was created for, its aim and background, directions, and resources for questions. We believe in order to facilitate social participation, that community mobility is key. Since driving is the most common type of community mobility in the United States, it's critical to address this IADL directly and consistently. As with any client factor, the generalist occupational therapist may need to refer to a specialist for additional guidance or direct intervention. This document assists the generalist with the screening process, scores and considerations for when to refer to an occupational therapist who specializes in driving rehabilitation, or an OTDRs. The GRID is a resource specifically designed for the general practice occupational therapy practitioner to integrate driving into their practice. This is a picture of just the top of the GRID, and we will go over the details in just a minute. Basically, the GRID will be a tool for you as a generalist OT to use to classify your client's performance skills, current capabilities, and potential for returning to driving. When combined with your clinical knowledge, the GRID is a tool designed to provide guidelines for the generalist OT to evaluate, create, and implement intervention plans to develop or restore the client's valued IADL of driving and community mobility. Before we get into how to use the GRID, it's important to understand its foundational base. The GRID is based on the framework of the OT Drive model. If you're not familiar with the OT Drive, we do recommend that you take a minute to review the article and fully understand the background. However, I'll take a moment now to give you a brief overview before moving on. As a review, the OT Drive model guides the occupational therapist to use their knowledge of a client's performance skill and client factors to help determine the level of driving risk, readiness, or need for a referral to a specialist. The red category indicates the client's impairments preclude the person from driving now. In some cases, impairments will prevent the client from returning to driving, and the therapist needs to work on driving retirement. In other cases, it may be that the client is not able to drive now, So working on improving function to return to driving is the goal. The green category indicates the client's impairments either do not affect driving or they are temporary. The client's capacities to drive are not impaired. For example, a client who has had a recent hip replacement may have an acute period where they may not drive. But here, there are no indicators that the client cannot return to driving after recovery. The yellow category indicates that impairments are mixed. It's not clear if the client has or does not have the capacities to drive. In many cases, the occupational therapist planned interventions to facilitate improvement in all client factors, and if it still remains unclear, it would now be time to refer to a driver rehabilitation specialist. The grid was designed to assist in this process of decision making. Let's talk about the aim of the grid. As with any client factor, the generalist occupational therapist may need to refer to or consult with a specialist for additional guidance or direct intervention. The grid offers guidance with the screening process, scores, and considerations when referring to an occupational therapist who specializes in driving rehab or an OTDRS. It is important to ensure a client has every opportunity to return to the important and valued activity of driving. This may mean an opportunity to be evaluated by the expert OTDRS, who will use evidence from more specialized assessments as well as their expert experience. The OTDRS can then offer the best clinical decision with less risk for over or under restriction of driving. It's important to understand that the grid is designed for generalists to determine the need for further evaluation and/or intervention, not for the generalist to make a licensing decision. As we look at the grid, you'll see a variety of columns: client factors, contextual factors, and categories for red, yellow, and green. The first column lists client factors, which include the major factors to consider when screening or assessing for driver fitness. These are not all the possible client factors, but specific ones that are most relevant, such as seizures and crashes, and are most commonly related to driver fitness, such as visual skills and cognition, and most likely to be available to the generalist occupational therapist. Keep in mind, all the information, except maybe the driving history, is generally gathered during the typical OT evaluation done for any client. The contextual factors offer relevant and specific information that must be considered for each client factor when determining the level of driving risk. Consider this to be guiding information to support your clinical reasoning as you determine the category of red, yellow, or green for each client factor. In each of the last three columns, you will find information to help determine red, yellow, or green category. You'll note that some of the boxes do not have a color or score because there is not a tool with evidence related to this client factor for driving. For these items, the occupational therapist needs to use their own clinical judgment. Keep in mind, while the grid lists several assessments under each client factor, especially under cognitive, it does not mean that all need to be completed. The therapist can use their clinical judgment to determine if more than one is needed. As you select the best screening tool, remember to address all the 7 major client factors. So how do you use the grid? First, use your knowledge of the client and your clinical reasoning skills to select and complete appropriate screening measures. Second, use occupation-based assessments, such as the assessment for motor and process skills, or the AMPS, in combination with your selected screening tools to gain a holistic view and understanding of the client's risk. Third, use the grid to categorize the performance of each client factor, for example, strength, acuity, trails making test, as to whether the performance belongs in the red, green, or yellow category. As you make this decision, carefully read and consider the contextual section and use your clinical judgment to incorporate knowledge of the client's performance from observed ADLs and IADLs. Finally, review the grid and consider the overall presentation of the client. Think about their performance during other ADL and IADL tasks. For example, here you see a patient completing a simple cooking task in her kitchen. She has agreed to make a sandwich. As she is searching her cupboards for the peanut butter and bread, she is forgetting to close the cupboards behind her. What does this tell you about her safety awareness? You might also take note of how she is searching for the peanut butter and consider if she is planning and organizing her search well or randomly looking. You might start to think, how does this impact her organization for more complex ADLs? We cannot emphasize this enough. Driving is an IADL. As OTs, we are skilled at understanding and addressing ADLs and IADLs. It is important that you use your skills as an occupational therapist and your knowledge of the client's actual engagement in occupations to gain a holistic view of the client. Now, if your client's scores on the grid are predominantly in the green, this likely indicates little to no driving risk. Assuming that aligns with your comprehensive understanding of the client's ADLs and IADL performance, provide the client with information on driving health promotion and share your results with the referring doctor. Remember, the grid is designed for the generalist to determine the need for further evaluation and/or intervention, not for the generalist to make a licensing decision. If your client's scores on the grid are predominantly red, this indicates that there are significant impairments and great risk. Assuming this client has maximized recovery and these impairments are persistent or progressive, provide driving retirement consultation and interventions to support appropriate community mobility. If your client's scores on the grid are mixed, some green, yellow, and/or red, and are not clearly a green or a red, this indicates driving risk. A referral to an OTDRS is indicated. Collaboration with the specialist is important to help determine timing of the driving evaluation. For clients who are scheduled for discharge but still have potential for improvement, refer the client to the OTDRS with the communication that they will be appropriate for a driving evaluation at a future date. Finally, here are some important points to reinforce when using the grid. No single test determines whether someone should or should not drive. The only exception is significantly impaired vision. Your state laws will guide you. Do not underestimate the ability to overcome physical limitations. Refer to the OTDRS to determine if equipment options exist to support your patient. Your OTDRS will be well versed in solutions and options. Cognition is critical for safe driving. Cognitive impairments alone may be a reason to stop driving. And remember, the occupation of driving is an IADL. Looking at the integration of vision, cognition, and motor skills in the context of occupation is the hallmark of OT. We encourage you to use your OT skills to complement the results from the grid to help determine appropriate referrals and patient recommendations. For additional information, we encourage you to review the commonly asked questions and answer document. It's our goal to share this information with occupational therapy practitioners and facilitate driving conversations. Please freely share the grid with our reference with other occupational therapy practitioners and encourage OTs to watch this short video to gain an understanding of how to use the grid. In addition, please feel free to reach out at any time to any of the authors.